Hello, this is Dr. Jerry Law, Director of Family Education and Leadership Training for Meadows Behavioral Healthcare. Thank you for joining me today as I share some important thoughts about length of stay for your loved one who is participating in one of our programs. Have you ever wondered just why our clinical team is so adamant about your loved one staying in treatment for the full time recommended? Is your loved one telling you that they've already received enough treatment and they're ready to come home? Perhaps you've heard that other patients are completing the program in a shorter period of time than what you're hearing as the recommended length of stay for your family member, and this has you perplexed. Well, let's take a few minutes and go over this vital topic. Length of stay is by no means an arbitrary number at Meadows Behavioral Healthcare. Rather, it is determined based on years of clinical research and treatment programming. I'd like to share a quote directly from the National Institutes for Health. And I quote, "Individuals progress through treatment at various rates. So there is no absolute predetermined length of treatment. However, research has shown unequivocally that good outcomes are contingent upon adequate treatment length. Generally, for residential or outpatient treatment, participation for less than 90 days is of limited effectiveness, and treatment lasting significantly longer is recommended for maintaining positive outcomes. Good outcomes are contingent on adequate treatment length. Treatment dropout is one of the major problems encountered by treatment programs. Therefore, motivational techniques that can keep patients engaged will also improve outcomes. By viewing addiction and mental health or behavioral health disorders as chronic diseases, and by offering continuing care and monitoring, programs can succeed, but this will often require multiple episodes of treatment." End quote. Now, what did all of that mean? Well, in short, the NIH recommends a minimum of 90 days of treatment. While in a perfect world, all 90 days or more would take place in a residential setting, we recognize this may not be practical from a demands of life and/or financial perspective. Therefore, our treatment programs are designed to provide the maximum benefit within a time frame that is realistic. Most of our programs are structured around a 45-day outline that ensures your loved one will receive the full benefit of the treatment that we offer. Each week in treatment is designed to meet your loved one where they are at, while also challenging them to move beyond their comfort zone and grow in their recovery. For example, a centerpiece at several of our programs is what we call Survivors Week. This is a week-long intensive during which patients have the opportunity to do a deep dive into trauma and/or other life experiences that may have a direct effect on what brought them to treatment, and very importantly, they will receive tools, training, and insights into how to deal with these issues going forward. Survivors Week needs to take place at the appropriate time during treatment. And should your loved one leave early, they may miss out on this opportunity or fail to have the chance to practice these skills while in treatment. Learning these skills is important, but having opportunity to hone them in a safe and supportive environment is absolutely critical. Another crucial component of treatment is Family Week. While this may not apply to all patients due to a variety of factors, this too is a critical part of treatment programming. Should your loved one leave early and therefore refuse to avail himself or herself of this offering, successful recovery may be negatively impacted. For patients who are not able to participate in Family Week due to any number of reasons, our team will be happy to make recommendations for family workshops back home. The point being, if your loved one intentionally leaves early and does not take full benefit of Family Week when offered, he or she, along with the family, is not able to maximize the benefits of treatment. One of the most valuable aspects of treatment your loved one may utilize is our Brain Center. At the various Meadows Behavioral Healthcare locations, patients use state-of-the-art neurobehavioral equipment to aid in grounding and self-regulation to confront their deeper issues with a calmer spirit. This cutting-edge approach addresses the neuroscience of trauma by attempting to better regulate the limbic system of the brain, which allows for better integration and implementations of the skills gained in treatment. Our Brain Center equipment includes neurofeedback, also called neurobiofeedback or neurotherapy, cranioelectrical stimulation, and several other state-of-the-art neurological treatments designed to maximize brain health. If your loved one leaves treatment early, his or her opportunities to take advantage of these powerful resources will be cut short. Upon completion of our residential program, patients are presented options for ongoing care or aftercare based on all relevant factors, but most importantly, on how well they progressed in residential care. We sincerely hope you and your loved one will accept these recommendations, as the evidence is clear. The longer a person remains at the highest level of care appropriate, the more likely they are to be able to achieve long-term recovery. Occasionally, reality dictates a longer length of stay in residential treatment. Factors such as detoxification, medication stabilization, level of participation in programming by the patient, co-occurring issues, and others may prompt our clinical team to recommend a longer length of stay. However, from a programming standpoint, a reduction in length of stay is rarely, if ever, appropriate. We sincerely desire that your friend or family member be able to attend and participate in all treatment modalities being offered. So, what is your role in this? Well, in addition to the entire clinical team supporting the full length of stay, the backing of friends and family is vital. Many people entering residential treatment have been reluctant to do so. So often these individuals have a history of manipulating their loved ones, and a history of enabling or rescuing on part of friends or family may be present. Please know that in no way are we pointing fingers at anyone for missed opportunities in the past to support recovery. Rather, we are hopeful that family members and friends will stand united with one another, as well as with our clinical team, in supporting what's best for each patient. If you'd like additional support around this, I'd be happy to share some additional insights as well in a video entitled Helping or Enabling, and How to Set Healthy Boundaries. Here are a couple of analogies that you might find helpful as well. I want you to imagine for a moment that your loved one plays a competitive sport. Let's use soccer for this example. So here's the scenario. It's late in the second half, with only 5 or 6 minutes left to play. Your loved one's team is up by a score of 8-2. Now you realize in soccer, this is a nearly insurmountable hurdle for the opposing team to overcome. Suddenly, the coach of your loved one's team walks onto the field and announces to the referee that he's had enough. His team has clearly won, and so he's going to take his players home. What would you think? Here's another example. Let's say you've completed all but the final semester of law school. You spent 4 years as an undergraduate and now nearly 3 years in law school. You are tired. You've spent significant resources, financially and emotionally, to get here. Now you've just had enough. You want to move on and truly believe that you can pass the bar exam even without the degree. What would your professors, classmates, friends, and family say to you? Well, clearly these examples are designed to present the obvious. In the soccer example, you'd most likely be surprised and even put off by the behavior of the coach. Both teams agreed to the terms of the game, and you expect them to play until the clock runs out. With regard to the story of law school, while there may be some truth in your concern or your contention that you could pass the bar exam without completing law school, what may be the long-term ramifications on your career? As a friend once told me, a marathon is 26.2 miles, not 26 miles. They don't give out any medals entitled, "Nice try." Your loved one also may have entered treatment as a suggestion or even a requirement of an employer or licensing board. These are powerful leverage points that you can refer to as reasons for your friend or family member to complete the full length of stay. In many cases, these third-party entities will require evidence of completion of treatment. We know that you would not wish to see your loved one lose their source of income or professional status as the result of an early, unplanned, or unsupported discharge. Now, I would be remiss if I did not also discuss the concept of AMA, or discharge against medical advice. Treatment in a behavioral health care program is akin to treatment in a hospital, in that when a patient leaves treatment early or against medical advice, negative implications may be the result with respect to potential insurance reimbursement and or the willingness of other healthcare providers to accept your loved one into their care. More importantly, research clearly shows a direct adverse correlation between AMA and an individual's success in long-term recovery. Once again, I refer you back to the statistics I shared from the National Institutes of Health at the beginning of this video. Lastly, what about patients who are receiving treatment under an insurance plan that will not cover the full 45-day program? Our team will make every effort to include as much programming and as many therapeutic benefits as possible in the time allotted. What is critical here is to understand that if your loved one is stating that others are discharging sooner than the 45 days, and he or she is eligible to stay for this full length of stay, we encourage you to stay the course. I'm reminded of the story many of us heard from our parents. So if Johnny next door jumps off the roof, that means you should as well? I remember hearing that as a child and thinking how ridiculous it sounded. But when it comes to completing treatment, this analogy carries a lot of truth. Just because another patient left treatment sooner than your loved one in no way makes it appropriate for your friend or family member to follow suit. As I've shared in other videos, these may be some of the most difficult conversations you ever have with your loved one. Learn the language of redirection. For example, I hear you, and I know that you're wanting to leave early. Please talk to your clinical team about your concerns. Or, I love you enough for you to be very unhappy with me, and in the place where you need to be, receiving the help you deserve, rather than happy with me because I joined with you in your plan that is not supported by your clinical team. You'll find value in practicing these types of conversations, maybe with another friend or family member, or even in the mirror, before your loved one can pull you into such a conversation. Well, thank you again for taking time to join me in this talk on length of stay and how your support may make all the difference for your loved one. If I may be of additional support while your friend or family member is in treatment, I may be reached at jlaw@themeadows.org. That's JLAW @themeadows.org, or call me at 928-668-1942. I look forward to assisting you in any way that I can.